We would like to extend a warm welcome to those who are joining us today and those of you who will view this recorded webinar at a later date. This is the second of a series of 4 webinars offered in support of a grant project dedicated to enhancing the inclusion of emergency preparedness and response in public health and health-related areas of study. A few notes for you before we get started. This webinar is being recorded and will be placed on an emergency preparedness and response online curriculum hub. The curriculum hub, upon its completion, will be a free and open source for emergency preparedness and response, or EPR, content and curricula. We look forward to engaging with those of you who have joined us today and will do so during the Q&A portion of the webinar, which will follow the panel presentation. That being said, feel free to add questions via the Q&A button throughout the presentation. We are joined today by students, faculty, and staff from Minnesota Private College Council member institutions, our partners from the Minnesota Department of Health, and representatives from the Minnesota State Colleges and Universities. Again, we're glad to have you with us. Next slide, please. We begin with honor and respect for the land and for the first people of this land. We are on the ancestral homelands of the Dakota people. We desire to honor and respect the first people and recognize their caring for our common home. Other sovereign American Indian nations, including the Anishinaabe, also have a long history with these sacred lands, past, present, and future. We, both personally and collectively, continue to have a deepening awareness of our complicity, of the complex history of colonialism, genocide, and broken treaties. We seek to understand the troubled acquisition of this land by unjust U.S. government practices, including the stealing of these lands and the forced removal from the birthplace of the Dakota people without any compensation to the American Indian communities. We acknowledge the past, current, and future impacts of this history on our relationship with our American Indian sisters and brothers. Next slide, please.
Hello, everyone. My name is Jenny Kluznik, and I'm a project consultant working on this webinar series, as well as the online curriculum hub related to emergency preparedness and response. We're so happy you could join us. I come to you as someone who's worked both in public health and clinical medicine and continues to teach. And I'm so excited to have you here and welcome you to this session.
And my name is Kathy Berlin, and I'll be serving as the monitor for today's panel presentation. Having proudly served as a nurse in the realm of public health EPR for 20 years of my nearly 37 years of nursing career, I am pleased to introduce you to the potential career pathway, one in which I have found tremendous reward and growth. Next slide, please.
Before we begin the panel presentation, we'd like to acknowledge the support for this webinar and the overall EPR project was made possible through a COVID-19 Public Health Workforce Supplemental Funding Grant from the Centers for Disease Control and Prevention. And this grant is being administered through the Minnesota Department of Health.
Next slide, please. A special note to students participating in this webinar. Your attendance at this webinar is a reflection of your interest in learning more about emergency preparedness and response. You may have an established long history of interest in pursuing a career in emergency preparedness and response, or your interest may be in the early stages of curiosity. Either way, we're really glad you're with us today. The next 30 minutes or so will be similar to a storytelling session. The panelists will tell the story of their public health journey, sharing real-life adventures, insights into the importance of disaster behavioral health, health equity and climate change, two areas that are intrinsically connected, and unique issues related to EPR in a rural setting. By the end of this webinar, our hope is that you have either more clarity or more questions about emergency preparedness and response. In fact, if you leave this webinar with more questions than you arrived with, you may be more inclined to pursue coursework related to EPR and eventually a career in public health emergency preparedness and response. Next slide. Welcome, panelists. We will have you each introduce yourselves, mention your current role related to EPR, and highlight your areas of interest related to EPR. Let's start with Janet.
Hello, everyone. I am very happy to be here with this group and happy to talk with you about my role in EPR. I come to EPR perhaps in a different way than the other panelists. I am, by training and education, a marriage and family therapist. Although I have been a disaster responder for about 18 years now, I haven't been engaged with EPR until I came to the Minnesota Department of Health a little over 2 years ago. And in that role, I am a regional behavioral health coordinator, which definitely fits with my background as a marriage and family therapist. But my role at the Department of Health is one of support and training, offering resources to public health. We started originally related to COVID-19 and then have expanded since then.
Great. Thanks, Janet. Welcome, Catherine.
Hi, everyone. Good afternoon. My name is Catherine Harrison. I am the Deputy Director of the Health Emergency Response Office at the University of Minnesota. I use she, her pronouns, and in my role, I oversee a lot of the planning and partnership work that our office engages with to ensure that there are plans, personnel, and resources available should an emergency happen either on campus or that significantly affects the campus community. But noting the dual mission of the university to both the students and the learning here, but also the communities across the state, we also respond to disasters and crises at the request of other jurisdictions and communities or at the state's request when that may happen. My particular interest in emergency preparedness is pretty broad. It is, I would love to say that it will always be how do we bounce forward or advance after an emergency or a crisis or a disaster, and be able to we don't usually think of emergency response as a proactive or primary prevention approach. But when a disaster does strike, it does provide opportunities to reimagine and transform the resilience in our communities and advance health equity, or at the very least, prevent, try to decrease the deepening of inequities that often result during a disaster. So thank you. Happy to be here.
Thanks, Catherine. Welcome, Jody.
Yes, good afternoon. My name is Jody Buddy. I work with Chisago County Public Health. I am what they call a local public health preparedness coordinator. I have been at this job since the very beginning when the position was created. So I'm on my 18th year with this position. I came into the position in a roundabout way, but the work that I do has incorporated everything I've learned from the time I left college until through the pandemic and to today. I started off as a clinical research analyst for Sandoz Novartis. My husband and I and our kids were transferred to Colorado. I started a business in Colorado, sold that, came home and thought, okay, I've done, service for a private corporation. I've been an entrepreneur. I wonder what the public service realm looks like. And so at that time, they were establishing a new position nationwide called emergency preparedness. And when I was reading the job description, I thought, wow, this has all the things that I already know how to do, which is a bonus. And also my areas of interest in regard to disease surveillance, emergency response, helping out the community. And the fact that I live where I work is also a bonus. So it'll be my pleasure to talk today about what my career path has done and what it has brought me, and looking forward to it. Thanks.
Thanks, Jody. Well, Jody touched upon this, and I'll ask the other two panelists to speak to this. But could you talk about your journey, where you started your professional career, and the twists and the turns that led you to your current position? Was your journey streamlined and traditional, or did your journey take a more circuitous route? Catherine?
Sure, thank you. Circuitous is a good word. My background is in nursing, so I have my nursing degree from the University of Minnesota and my master's in public health from Berkeley in California. But in the interim of, working at the bedside in Colorado to being back here at the university in this role, it was a very circuitous route. In fact, even coming into nursing was unexpected for me. I went into my undergraduate training expecting and fully intending to enroll in the journalism school here at the university. So I was interested in journalism. I was interested in bearing witness to the things that I could see around me in the world that I felt needed to change. And as I continued on that path, I found that despite the critical importance of bearing witness, I was feeling called to engage in more action, and really saw health as a central kind of linchpin spot to be able to work on all the things socially that I wanted to, whether it's education, economics, housing, food security, et cetera. So what we often think of as the social determinants of health. So across my career, I've done everything from global maternal child health in West Africa to adverse childhood experiences and toxic stress in San Francisco to climate change work. And in the middle of all of that, I did end up here at the university during the H1N1 pandemic. I had just finished bedside nursing and returned home to be with my family while my grandmother was in hospice care. And in that time, I also needed to work, and there was a position open that was meant to be very temporary and ended up being 4 years, which often happens in many places, but especially at the university. And that was really my first taste of emergency preparedness, was trying to do mass dispensing clinics during the H1N1 pandemic. After that, I left and honestly thought that I had left emergency preparedness behind. I went and got my master's degree in California. As I mentioned, I did the maternal child health work. I really wanted to do, ACEs and toxic stress work, et cetera. But the thing is, when you're someone who has a lot of interests and a new interest comes along and you don't necessarily have a formal policy against saying yes to everything, but you end up saying yes to everything, I said yes to an opportunity to work on climate change. And in that role, which unfortunately, it was an excellent opportunity. And unfortunately, as things go, as political winds shift and policy changes impact resources and funding, we did lose our funding in 2017. And that brought me back to Minnesota and into contact with emergency preparedness folks who I had met at that intersection of climate change and emergency preparedness and a focus on resilience. So that's what brought me back into this space. So not only circuitous, but perhaps in and back out again. And really, I think it speaks to the testament of public health as having so many intersections, and as emergencies and disasters occur not only along a spectrum, but with climate change occur more frequently and have so many far-reaching impacts. There are lots of avenues into the work. And so I was at the city of Minneapolis during the first part of the COVID pandemic and came over here to the university during the second part, or as we sort of lingered in the aftermath of it. And as that has subsided in terms of our focus and energy, been able to bring back some of the other projects and focal areas. So kind of getting deeper into some of the other all hazards emergency preparedness work that was sort of set aside during the pandemic. So that was my long and winding path to EP.
Thanks, Catherine. And Janet?
I got a bachelor's degree in English literature. And unless you're planning a teaching career, or maybe in library, you don't have much to do in terms of a career with English literature. And at the time, I didn't think I wanted to teach. So I got a job that eventually I was coordinating a doctoral program, and I did that for a long time. Then I left that and opened a gardening business, which had nothing to do with English literature either. And after a while, because Minnesota is not all that great for a gardening business in the months of December and through February, I decided to pursue something else, and that something else was marriage and family therapy, and went into that world as a therapist. And wouldn't you know that in addition to being a therapist, I got to teach graduate level marriage and family therapy students. So I really did teach, even though it wasn't so connected with English literature. I continue to do therapy work. I have a small private practice, and of course, being a behavioral health specialist and supporter keeps me in that mental health world. Here I am with adding disaster response to that interest in the therapy world. But mine was circuitous too, but perhaps not as many twists and turns as Catherine or Jody. But I find probably it's more fun not to make a straight path, but to try a few different things.
Thanks, Janet. Let's take it education, pathways, options, and choices. I think I'll start with maybe Catherine with this one. And you spoke a little bit about this, but what did your academic preparation look like? And what advice do you have for students considering public health EPR as a career?
Sure. So yeah, my academic preparedness was in nursing. I did a bachelor's of nursing, and which did include a public health course, but that's all of public health in one course, and then some clinical placement. And in that, when I was in school, the emergency preparedness work was still pretty young. It was only about 5 years old. And so I just had no awareness of EPR at all. And even as I was doing some of it in H1N1, I really didn't have an understanding of the structures that now exist and that I feel like I know off the top of my head. So one piece of advice I would give is to connect with your local and state health department, to those teams, and say, what is your practice all about? What is your area really all about? Of course, there are resources and classes. I'm not sure about some of the institutions on the council, but I know we do have an intro kind of emergency preparedness breath course. I know this hub will be an excellent resource. I would encourage folks to just go out, explore, ask questions. And those of us, even though I'm no longer in local public health, have spoken about the need to build the pipeline and build connections to folks coming into the field. So there will be people more than ready to speak with you, answer your questions, and tell you kind of what it's all about. I think I'm not sure if we'll come to this in another question, so I'll just say it here that I think in general, at least when I was in school, you aren't really taught how public health looks in the real world. And I don't mean so much in the day-to-day of what people do in public health jobs, but really in the structures of how it's set up, because so much of what it looks like depends on how the funding works, where it comes from, what responsibilities are set forth by accrediting boards or governing boards or Congress and laws and directives and those sorts of things. So trying to get an inside look at some of those, that infrastructure would be a great kind of crash course intro into the field.
Oh, great. Thanks, Catherine. This is a question you might have to think about for a second before answering. And Janet or Jody, what do you know now that you wish you knew during your, let's say, undergrad or graduate school? That would have eased the way as you face challenges, as we face challenges in either undergrad or grad school and making a decision of which way we're going to go. What do you wish you would have known back then to take some, I think, pressure off yourself or make it just a little bit more of an enjoyable ride?
Oh, I'll go ahead. I wish that I would have believed it when people said, have fun, find what you love, do that, enjoy it because you'll get where you need to go. I heard them, but I thought, oh, it might be good advice for other people, but I don't know if that's the case for me. And I did have fun. I did get where I wanted to be, although I didn't know this is where I wanted to be. But that would be my advice is it's very trite. Enjoy the journey, enjoy the process, but really it's true. I think the more we enjoy where we're at and what we're doing, we get into things we had no idea we'd get into, and then we find, oh, I really enjoy this. I really like this. So trust that.
I guess I would say, I wish I would have known how important relationships are in building collaborative partnerships. And that the best thing you can do, you can write the best plans in the world, you can have your grants lay out all the duties, you can be very academic on how you approach the position. But at the end of the day, when push comes to shove and a pandemic hits, it's about relationships. So what you can do to build the rapport and the friendships with the leadership, not only in your own public health department or the region or with emergency management or law enforcement, is to get to know as many people as you can in your community that would have a leadership position. So when push comes to shove, you know who you can count on, they can count on you, and that those relationships will become indispensable when the time comes and you truly need them. And so when I learned that it was about building collaborative partnerships, having everyone on the same page, unified command, unified messaging, it makes all of our jobs easier in being able to serve the community. That is something that it never even occurred to me because I approached in the beginning of my career, the positions that I had, which were quite statistically based, and research and what it really does come down to is relationships.
Thanks, Jody. Catherine, do you have any recommendations for how to try out this line of work? So let's say you're a student and you're trying to figure out, I wonder if this would be interesting, with summer job, an internship. I know one way is volunteering. Can you think of ways that students can just tip the toe in and see if this might be of interest?
Sure. I think we often name the silver linings of the pandemic, and I think that one of them is a recognition of the way that public health locally and at state level needs to be more supported. And so there are lots of new funding opportunities that are making it possible for public health or public health education programs to create new opportunities for that students could try on. So I'm not totally up to speed on all the requirements and eligibility for these, but everything from public health corps to an unpaid position as a volunteer with your local medical reserve corps are really great. I am really proud of the state of Minnesota for putting forth state level funding into local and state public health in what are called sustainability grants that I know a lot of local jurisdictions are using to bring on much needed staffing, whether in the form of full-time staff or student workers. The University of Minnesota has a school public health internship program. So if your school has something similar to that, where there's funding available to place you in a local jurisdiction, that can be really beneficial. But even if you're unable to find a paid position, if there are project requirements for your courses that give you flexibility to say, you know what, I'm gonna apply this project requirement to EPR and a local need and see if I can partner with my local public health department to host this project, or your capstone or whatever it might be called. I know all the institutions are different. So, and then again, the Medical Reserve Corps, I know that most of these are county-based. We do have one here at the university, and have had conversations with other colleges about starting. These are trained responders that have a medical background of some kind, though don't necessarily have to be licensed, to respond in public health emergencies. So those are just a couple ways. There are many others, and I think again, those put another plug in for the hub that's being developed through this project. I think will be a great resource for that.
Thanks, Catherine. Jody or Janet, do you have anything to add to that?
I'll put a plug in for the University of Minnesota School of Public Health. I got my master's certificate in emergency response and recovery, and I got about 3/4 of the way through a master's degree in epidemiology as well. But life took a turn, and I just decided to kind of stay put where I was in my career path here at the county. So I never really finished my master's in epi, but the School of Public Health was a wonderful opportunity. I remember sitting in the classroom with, and I don't know if they still have this program, but if you are going to school and getting a degree in public health, you can also get a dual degree. So we had a lot of students that were there that were also veterinary students and I believe nursing students as well. So when they graduated, they had a dual degree in public health and in their degree of choice. And I thought that was really interesting and a wonderful opportunity for students to do that. Here in Chisago County, we support 2 or 3 different colleges that have a nursing rotation where they come in for 6 weeks, and they anywhere from 10 to 15, something like the largest class we ever had was 20. And they come in and they learn all aspects of the programming that we have for evidence-based programming, maternal child health, WIC, preparedness, and they do their rotation in public health for that time. Bethel University is one, and we've had a couple other colleges over the years as well. And I've always really enjoyed having the students tag along, because none of them know what preparedness is. And so when they come in, they're usually flabbergasted going, this is really interesting. And the nice thing about it, and this is something I can plug as well, is I never have the same day twice. And for me, that's really important because you're always doing something that's going to move your program or the county or your community forward, which I like very much.
And I'd add a note about the behavioral health MRC. It's a statewide organization that responds similarly to university and county MRCs, but with a focus on behavioral health. And we'd love to have more volunteers join us as well.
Hey, thank you. Jody, you alluded to this, and this is what leads me to our next set of questions. As students start to imagine what it would be like to be a public health professional and work in EPR, could you, each of you, describe, what a typical day look like, which we all know there isn't one. What does a typical day look like? Do you work alone? Do you collaborate with people every day? How much autonomy do you have? So can you talk about, in your position right now, if someone was looking in, what would they see in a typical day or week? And that's for a toss up. So whoever wants to go first.
Go ahead, Janet.
Okay.
Continue us on.
Thank you. Well, so I have a dual role. I'm the regional behavioral health coordinator for the Metro and Southeast regions. And I'm also the unit coordinator for the behavioral health MRC. So both of those sort of work together, but they definitely mean not one day is like another. I work with one other person to coordinate the MRC, but I work with 3 other teammates on the regional behavioral health team. So we cover the state of Minnesota in supporting public health. So we do trainings, we offer a variety of resources. We are offering right now a program on trauma-informed care when it comes to response and recovery. So we're doing a variety of things that way with the MRC, also doing trainings and gathering volunteers and creating a program so that we are ready when a disaster happens. And I agree with Jody. I love that there's so much variety that one day is not like another. It makes things much more interesting.
Before we move on to the next panelist, Janet, could you speak just for a minute about what kind of incidents do you respond to with the behavioral health team. So when would that team be deployed by the state?
Sure. We can be deployed for a variety of reasons. They can be a large kind of deployment like northern Minnesota floods, or when there were southern Minnesota floods, those kinds of things. But also we can be deployed. There was a deployment after a shooting that involved one individual. There was a deployment after a local school in Minneapolis. There was a boiler that exploded and there were some injuries and a couple of deaths. So both small and what I mean by small in terms of number up to a larger group, we can be asked to do a number of things. So it's a nice variety of the deployments that we get called into, again, to provide behavioral health support to survivors, but also to the first responders. We support them as well.
Catherine, what's your
Sure.
typical day, your non-typical day look like?
Yeah, well, actually, it's funny as I was like, I should just pull up my Google Calendar and see what I've been up to today. But I think that it is like Jody said, it's a no 2 days are the same. It's a great variety. You know, my role as both kind of an administrative leader in our office, as well as the primary point person for planning. I have this week so far, earlier today, I met with two of our primary planning partners, our Department of Emergency Management and our University Police Department. We are in the middle of planning for if a large mass fatality or mass casualty event happens on campus, and where would we convene? Where would we provide those supportive services like Janet mentioned? Where would we reunite families with their loved ones? And so we're actively working on building together the plan for what we are calling our Campus Assistance Center, and figuring out, you know, as a living learning community, what are the needs and resources that we have to take into consideration that might be different, you know, for this population of young but independent adults as well as others, and kind of putting all those things together in a plan. So actually at the end of yesterday, I was just sketching a large floor plan out on my giant whiteboard and kind of getting into that, some of like that really nitty gritty, like head down planning work. But other times it is engaging and with partners. So we are housed here on the Twin Cities campus, but we coordinate very closely with our other 4 campuses in Duluth, Morris, Crookston, and Rochester. And so we hold periodic coordination meetings where we just come together and I facilitate those, and they bring forward needs and questions and issues that they're facing or things they're learning, resources they're using. And we just have that more collaborative and sharing space. Then, of course, if something happens, we respond. So a couple weeks ago, we had what looked like it could be a cluster of norovirus cases in one of the residence halls. So GI illness, which is probably one of our most common responses. And as the lead for that response on campus, our role is to pull together all the operational partners, whether it's housing, dining, sanitation, communications, the health service, to bring everyone together, say, what's the plan? What do we need to do? What does MDH say? So we get our trusty state epidemiologist team on the line and talk to them and really take their lead on, you know, do we need to treat this as an outbreak? Are we just monitoring, that sort of thing? And then put together some action steps and put that into action regardless of what else is happening in our day. So that's a little bit of what I do on a day-to-day basis. We're also, I'll just put in a plug that we're celebrating 20 years of our office and our Medical Reserve Corps this year. So we're doing a lot of celebratory planning and looking back on the last 20 years. So writing a 20-year report and planning for some of those things that are all part of the work and really important to recognize some of that historical and future visioning, but isn't necessarily emergency based or like work. It's it's a really fun work, I should say.
Thanks, Catherine. Yeah, I was gonna move forward and ask you a question. It's a important, I think, question for students, especially to hear. And for those who haven't had an experience in EPR or EPR, as Janet mentions, which I think is another cool way to say it. Could you each provide an example of work that was particularly rewarding for you? So it's something in EPR or attached to EPR that stays with you. I know for me, it was when I worked with the evacuees from Afghanistan, something that won't ever leave me, and I enriched my life in a way that that is just I can't forget. So could you each mention that? I'll start with you, Jody.
Yeah, I would say our pandemic response locally is something that as planning section chief is what my role was during the pandemic. Our incident command worked diligently before the vaccine came out to try to cut through all the misinformation that was out in the media and on social media, and trying to get unified messaging and those relationships that I talked about earlier in regard to building those partnerships where the school superintendents, the police chiefs, fire chief, emergency management, the county administrator, county attorney, all of the leaders that we had in the community, we had a unified command. And one of the things that we made sure every single morning at the very beginning of the pandemic is that we had the same messaging. It was very simple, and that we cut through all of the almost too much information that was out there. And we basically kept telling people every single day, and that message never changed. Cover your cough, stay home if you're sick. You know, all the different messages that were out there that got lost, honestly, in a large part of the pandemic. We were also huge proponents of using data, and this is where my background came to help a lot, is based on all these relationships, we also got what they call the line list every single morning, which would tell us from MDH all of the cases that were lab positive that fought the previous day. So we knew and we mapped on a GIS where those cases were, and we were able to sort using a database that I built that would tell us where there were possible outbreaks. We would then intervene and come in with our nurses and our public health director or myself or whoever it was that the partners were asking for, whether it was a business or a school or wherever the outbreak, or a jail or the prison. We would be able to step in really, really early and say, hey, look, you've got 2 cases now, it's going to be 10. Here's what you need to do in order to make sure that the people in your area are safe. And we would educate, and we would give them resources that they need, whether it was gloves, masks, hand sanitizer, whatever. And we're really proud to say in the first 8 months of the pandemic, prior to the arrival of the vaccine, we had, if not the lowest case rates, hospitalizations, ICU rates, and fewest deaths of any county in the entire state of Minnesota. And we focused on our own people in our own county. And then when the vaccine came out, we made the decision that we would, even though the governor said, put shots in arms, whoever comes, give them shots. We said, nope, we're going to vaccinate our own people first. So we did our own residents and the people that worked in the county and focused on that, kind of with the idea that, you know, when you're on an airplane, they say if the oxygen mask comes down, put yours on first. We totally believed in that was going to be a way to keep our community healthier faster. And in the end, with a county of almost 60,000 people, we only had, I believe, 112 deaths. And so we did really well, and it was a lot of work. We had liaisons that were made up of nurses who had each sector partner as a devoted subject matter expert. So everybody felt supported. We had the same messaging. And if I had one thing that I was the most proud of, was everything that we had trained for 18 years came to fruition during the pandemic, and it worked. The incident command, the unified messaging, everything that we did. And we had just a stellar staff that was devoted. And so, yeah, that's probably one of the things I'm the most proud of.
Thank you. Thanks for sharing that public health success story. Always great to hear those. Catherine.
Yeah, I think there are a lot of different ways to kind of categorize these experiences, because sometimes, again, the most sort of satisfying experience is just like digging into a good whiteboard plan and checking stuff off and getting a plan in place. Like that really feeds my organizer brain. But I think the all around most fulfilling experience, and one of the most memorable was the opportunity to pilot a climate resilience hub with Little Earth of United Tribes while I was at the city of Minneapolis. And I'm so glad to say that through a number of partnerships, the city has been able to continue an investment. It is implementing 3 more resilience hubs in the city, which is just terribly exciting. And the ability to, so having not come into EPR necessarily, again, circuitous, but even in this space, having an interest that is challenging for people to keep in the front of their minds, climate change, even though we are steeped in the change and surrounded by it. It can be hard to kind of sometimes get our arms around it, and focusing on resilience, focusing on that bouncing forward, particularly with marginalized communities, living on their own land, but stolen from them, and the impact of trauma that that has had, and trying to rebuild kind of a really deep recovery, almost, if you look at it like a centuries long kind of lesson in recovery and partnership and allyship, and being able to just, yeah, do something a little different, and engage at a hyper local level, community participatory work and power building. And it was just really satisfying. And I think part of that grant, which was from a foundation out in Washington, D.C., that was from Pew Charitable Trust, where that we got to go to the grantee convening, like sometimes happens. So they fly you out, you know, it's lovely, you get to share ideas. And we decided we wanted to bring our community partner with us. So we brought Little Earth. We were the only jurisdiction to actually bring our community partner with us. And she, you know, it was a really excellent experience in so many ways. And then we went and met with legislators to talk about the importance of climate resilience. We met with all of Tina Smith's team. We met with Klobuchar's staffers. We met with Representative Omar's staff. So, and just to be able to do that all together was a really incredible experience. So yeah, that's my favorite experience in EPR so far.
Thank you, Catherine. Janet?
You know, deployment is always very meaningful because you know that you are assisting people in a great hour of need. But I think one of the things that I'm really proud of that we have done as regional behavioral health coordinators is for the last 2 years, every month we've provided a number of trainings for people. So we have been training public health folks, healthcare people, disaster responders, and others who have come along the way with us, not only in things like psychological first aid or skills for psychological recovery, but also in much more specific types of training, like de-escalation of stressful situations and people, or ambiguous loss, grief and loss, trauma, a variety of trainings that have been intended to help our volunteers feel more ready to go and do their work as volunteers in the MRC, or have assisted our public health folks in the process of working through what they've just been through for the last 4 years of COVID and the challenges of response and recovery. And I'm really proud of that, because that takes it beyond just our own experience, and it has provided support and training and resources for so many more people. So I'm very proud of that opportunity we've had, and that we continue to provide, and I think has been, at least the responses we've got, has been very helpful for the folks who've attended.
Well, thank you, panelists. We're going to move on to our question and answer with the audience. And I just want to say, I have several more questions that I didn't get to, and I'm guessing that, you know, people who are viewing this webinar have the same feeling. Hearing your stories, It helps me remember why I'm in this, profession and how meaningful it's been. And so, I'm gonna hand this off to Jenny, and we're gonna take some questions from the audience.
Thank you so much, Kathy. So if anyone who is on the attending, if you have any questions, please feel free to drop those in the chat. I have one question that I'd like to propose to the panelists. First off, thank you so much. I was sitting here and more excited and just inspired by all your work. One of the questions we had is, who would you feel was the most influential in your career path, either in your winding journeys or in EPR? And can you speak to the importance or role of mentors?
Catherine, why don't you go first, Catherine?
My exuberant nodding gave me away. Yes, absolutely. So I feel that I have had the enormous blessing to learn from and practice under and work for several really strong, notably all female leaders in every job I've been in, who are all very different in their approaches and styles. One in particular has remained a long-term mentor to me. She was my director of nursing while I was at Boynton Health Service it was now called Boynton Health here at the university during the H1N1 pandemic. Her name is Jean Ayers. She was our director of nursing, and her background is public health, but similar to me, very broad, very social justice focused. And both in that role, she helped to expand. She just introduced me to a lot about public health, because again, this role was sort of cast into the fire of public health emergency response and public health in general, straight from clinical nursing. So had not had any formal public health training at all at this point, and provided personal, professional mentorship, encouragement, recommendations. It was a sounding board, was sometimes a venting ally. And again, 10, 15 years later is still a really important voice, confidant. And I think being, not mentors are not always intergenerational, but I think that is really a major benefit. And yeah, cannot say, it is actually one of the things I recommend almost whenever I have a chance to meet with students, and offer to be one until they find their person, because it takes time to find that fit. And even if I can't be someone's mentor person and presence, to at least be a resource, and then maybe connect them to someone who could be that ongoing guidance in their life throughout their career.
Thanks, Catherine. Janet or Jody?
I would say that my, one of the best mentors I ever had was when I first came out of college and went to work for Novartis. I had a supervisor named Dr. Alice Bunker. She was the team lead for our clinical products division, and she was one of the most dynamic, intelligent people I'd ever met in my life. And one of the things in my career that I've had happen, which is pretty unique for people, is every position I've ever held in any organization I've ever been, I'm the only person with that role. So it's been really hard to have other colleagues that you can visit with and say, hey, what about this project we're working on? I've always been that only person in that position, which part of me loves, because there's the level of independence has been wonderful. But there's a part of me that I think misses out on doing, like the nurses do their I forget what they call it, but they all get together and they do case review and things like that. I've always was sort of jealous that they had someone that they could share their war stories with and learn from. And I've never really had that. But Dr. Bunker taught me two things that I carried throughout my career. And here I am, 30 years later, and I still do this. One is, if you know what you're doing is right and it's going to move the company or the agency forward and it's best for the community, don't ask for permission, ask for forgiveness was one of her mantras. And she said, you'll get more done doing that as people see you lead than you will having to constantly look for someone to shoot you down. Which I thought was wonderful advice. And I've sort of lived by that, and that worked out really well. The other thing is I watched her in her career, and when she retired, she got kind of bored with retirement and chasing after the grandkids, and she decided she wanted to go to the Peace Corps. And I thought, my Lord, if I turn 65 and I'm bored in my retirement, I can go and do something else as well. And she ended up doing amazing things in the Peace Corps in Eastern Europe and the work that she did. So she was always a mentor of mine and a very, very good friend. Someone that I can aspire to be even in retirement, which is not that far away from me. So that's
Thanks, Jody.
Yep.
I did not go seeking this in particular, but it turns out that a number of my mentors have come to me through education, whether it was my advisor for English Lit or a faculty advisor, two men who believed that women in general, and me specifically, should be in leadership and supported me in ways that I wasn't even clear about for myself. And then a significant mentor for me, because of my specialization in trauma, grief, and loss, has been Pauline Boss, who created the ambiguous loss theory and taught me and supervised me, and then became my friend and continued to teach and mentor me in an understanding of ambiguous loss and the work that I was doing. And then finally, I would say my current supervisor, who's Nancy Carlson at MDH, has been a mentor to me as we navigate government, which this was my first experience working for a government, and navigate all the acronyms and all of that we find in our work, but also the ways that going back to what Jody first said, the ways in which Nancy has created relationship over the last 30 some years of her work in public health, relationships all throughout Minnesota, throughout the country, and how she has used those relationships to further the work that she has done and the work that we are doing now. So I have been very fortunate and can't say enough about finding mentors. And I like Catherine's idea of being a mentor until someone identifies who that person might be. But I think it's a wonderful thing to have mentors in our lives.
Thank you. Thank you all panelists and the participants who are viewing and joining us today for this Public Health Emergency Preparedness and Response career panel presentation. Students, Jenny and I want you to feel free to reach out to us. We have our emails here, and we're going to follow Catherine's and everyone else's lead here as mentors. Please reach out to us. We love working with students. If you have any questions or any guidance that we might be able to provide, please reach out to us via email. And then one final note, we have 2 more webinars in this four-part EPR series, and the panelists touched on both of these, crisis communication, and then a way to volunteer and a way to be introduced to emergency preparedness and response in a really meaningful way. So on March 21st, we're going to provide an introduction to the Medical Reserve Corps, which is an educational and experiential opportunity for faculty and students. I'll be co-hosting that webinar. And then April 24th, we have a crisis and emergency communication webinar. So we invite you to register for those. You can find that registration on the Minnesota Private Colleges website. So again, I want to thank the panelists for being here. I appreciate the time that you took to share your stories. And thank you all who are listening and who will view this at a later date.